To my presentation on methods to combat employee dissatisfaction and increase quality of care by Sterling Jones. To begin, let's look at the introduction. Horizon Specialty Hospital is an organization that is patient and employee-centered. The democratic management style is extraordinary, although just like in any organization, a manager may not really understand what's occurring on the floor. As I have spent my time at Horizon, I have noticed an overall dissatisfaction and numerous complaints from staff, which is directly affecting the quality of care. Many patients express how little they feel noticed or cared for, although the nurses and respiratory staff feel just the same. There is a disconnect in the organization centered around the employee satisfaction, which I would like to target in this paper. So the discussion, struggling, burnout, and dissatisfied employees. The three problems are struggling, burnout, and dissatisfaction. In struggling, a quote that I found from Honeybee explains half of employees spend 3 hours or more thinking about or dealing with financial issues. As a result, these employees are more likely to take unplanned absences or experience pessimism. They're at their desks, but their minds are elsewhere, and they struggle to meet deadlines and maintain a standard level of productivity and quality of work. Burnout. Burnout among healthcare workers, mainly medical staff, has become an occupational hazard, with its rate reaching 25 and 75% in some clinical specialties, and especially during this time of COVID. Furthermore, it was reported that among the sources of occupational illness, burnout represents 8% of the cases of occupational illnesses. These conditions can increase the healthcare costs for employers as well as the employee health conditions, then worsen. And dissatisfaction. When 85% of engaged employees display a genuinely caring attitude towards patients, while only 38% of disengaged employees do, an engaged employee can be the key to great quality care and patient satisfaction, from Dewar J. 2015. So, what is going to be our recommendation? Well, our recommendation is the Employee Wellness Program. The Employee Wellness Program has three goals: to offer local resources to those who are struggling financially, to offer an EAP therapist who will help those who are experiencing prolonged burnout, and offer a line of direct communication in a supportive fashion. So the EWP continued. Financially, the program will offer distress help lines like SAMHSA, 3 Square Food Bank resources, and Nevada Diapers and Diapering Assistant services for baby supplies. Even Discovery Gardens Children Care, which offers childcare for essential personnel, are all part of this part of the organization. Helping shows that we care and have empathy for our employees, and this can strengthen the bond between the employer and the employee. They will understand that if they need assistance, it will be coordinated for them free of charge. The EAP therapist is a very essential role in this new model. We will hire 2 professional therapists or counselor who can support the employees during these times of crisis, who they can visit at any time. There will be 2, one available during the night shift and one available during the night shift, so that assistance is around the clock. This EAP therapist will also offer these programs mentioned above to those who are struggling. Attending sessions can reduce levels of stress and anxiety and improve outlook on life. An EAP counselor can help you overcome a serious obstacle, and they can assess you and refer you to providers who can then also assist you. And if you need to make new life changes, they can assist you in that as well. And communication. The EAP therapist will also allow for conflicts to be handled efficiently and effectively within the workplace. They can explain issues and support the employees as needed. The employees can report any issues directly to the therapist, who in turn can inform management of any needs or recurring themes within the organization. This is unlike having an easy to forget bulletin board, but an engaging conversation with a trained professional who knows how to handle these issues. And like Dr. Wayne Dyer said, see the light in others and treat them as if that's all you see. In conclusion, with implementation of the Employee Wellness Program, an increase in quality care is sure to result. A supportive staff will decrease burnout and turnover and will build a stronger relationship between Horizon Specialty Hospital and their staff. Thank you so much for listening to my presentation and have a wonderful day.